Thank you for joining us on the
Non-medical.
Thank you for joining us on the non-medical education track. Please note, if you guys are a physician seeking CMEs, you should go to the medical track session. To kick us off, we have Teresa Summe here, and she will be presenting on asthma-friendly schools and childcare. If everybody wants to save their questions for the end, we'll get to those towards the end of the session here. And to kick it off, Teresa, I'll hand it over to you and you can do a brief introduction and then go ahead and get started.
Okay, can you guys hear me okay?
Yes, ma'am.
Okay, just so you know, my name, I guess, it's Teresa Summe. I work for Lee Health in Southwest Florida. I am the manager for our asthma and COPD management. We do diagnostic and teach self-management tools to children and adults, because as you all know, there's more adults with asthma than children. So I'm also very active with the Florida Asthma Coalition. They helped us get our program going. They're a great resource for everyone that's in the room. I'm on the board of directors and the co-chair for the provider work group. I just cannot encourage you enough, and I think Brittany would agree, please join work groups. We need input from everyone. So this is childcare. I really have a passion for it. It's not, I joined the work group is what I'm saying. I'm not the co-chair, but we need, I spoke to some childcare centers this morning and said, we really need your input. I'm not in the childcare center. So I'm also active with the Association of Asthma Educators. We did the mini review course yesterday. I'm the president at this time for the organization, and for their education committee, I'm the review coordinator. I know Wanda did a great talk. She provided us with a lot of information as far as statistics for children. This is a little different, so I'm just going to go ahead and review some additional information. I sometimes as a speaker do things a little different. I am happy for you guys to unmute and ask me questions, okay? I like interaction, or if you want to do it at the end, it's fine. But I try to be a little informal. Okay. There's more than 25 million people in the United States with asthma. And as you all know, that's about the same everywhere, but you can go to different sites. You want to make sure you use reputable sites, but that's the latest number when I looked it up in research. There's currently 15% of the United States population with asthma. That is huge if you think about it. The asthmatics have greater than almost 200,000 hospital admissions annually, and collectively, approximately, you can see 1,564, not 1 million, sorry, 1,564 and 440 million emergency department visits. And I'm sorry, it's blocking, some of this is blocking my screen, so I apologize. There we go. So the total indirect and direct costs associated with asthma care in the United States is over $80 billion a year. So that gives us the support for those. I know there's a lot of talk when you're opening asthma clinics and doing education and diagnostics that there's concern that you may not get reimbursed. So please reach out to me. There's a lot of ways to get reimbursed. I think when you look at the cost savings, we could do $80 billion, but for me, it's really, and probably I'm sure with all of you, it's about that child that is damaging their airways each time they have an exacerbation. And that was mentioned earlier in the talk. So some more statistics, and then we'll move on. Nationally, there's 5,500,000 children ages 17 years of age and younger with a diagnosis of asthma. So that's not asthma, just saying they have it, it's with a diagnosis. Approximately 3 million asthma exacerbations for children in the last 12 months. So every one of those, every time they have an exacerbation, they're losing a little bit of lung function. There's also for adults, about 19 million adults with asthma, and there's a little over 8 million asthma exacerbations for adults in the last 12 months. Here's where it matters and where I think most of our hearts are. This number stays consistently the same each year. There is 3,400 deaths from a person with diagnosis of asthma. It should always be 0. Not even 1, it should be 0. There is so much we can do if we just get the tools to the patients. And a lot of times it's the asthma community. They may not be in the hospital, to the parents. And worldwide, and I'll show you why this matters, we have 235 million people with the diagnosis of asthma worldwide. And it's predicted that 500 million people will use a healthcare app. We are all, and I think most of us would agree, we're doing healthcare differently these days. I know we see our patients in person, and then every other week we do telehealth. And with the pandemic, the surge here recently, we were just talking, my group is here, they're all certified asthma educators, nurses and respiratory therapists, and we're probably going to be doing a lot more telehealth for the safety of the patients. Okay. So there's virtual ways, of course, doing things. So when you go online with the Florida Asthma Coalition, and I hope most of you are, I apologize for these. You'll see I did snapshots. I could not get them to copy paste. I really tried. The point of this, though, this is an interest form for those of you that are working to have childcare centers be asthma friendly. You'll have to turn the interest form in first. They will not accept an application without this. And I'm going to explain why. This is how we work this at Lee Health, and we've had really great success. Okay, this is a mentor map. So let me go back. So this is your interest form, correct? So the first thing you're going to do is you're going on the website and you're going to fill this out. You're going to send this, the directions are very clear on this, to send this to the Florida Asthma Coalition. They are very quick about turning things around, which is great. So when they turn it around, they'll send to me. They'll first, go to this mentor map here, which is also on the website. And if you look down in the gray area, that is Lee Health. And I'm the mentor for those 6 counties. And if you think about it, it's pretty hard for me to keep up with 6 counties because I also have my job at Lee Health. So what we do is our whole team is working to be mentors. Right now, Robert Seifert, who is one of my colleagues, he is also will be a mentor. So there will be more of us to help all of you. But even if I'm not within your caller area, you can call. I'm happy to answer questions and get you to the right person. So they are, at this point, they're looking at the mentor map. They're saying it's Teresa's area with Lee Health. So the first thing I'm going to do is I'm going to contact the child care center or school, and I do that within 48 hours. While someone is interested is really when you need to talk to them, while they're still thinking about, being asthma friendly, because we're all very busy. So I just send them a short email, never long and lengthy, because I think I've learned with when you have multiple emails, a lot of times you're glancing instead of reading in detail at the moment. So I send the email and I introduce myself and say I'm there to help them. But I'm also, at that point say, can we meet for 15 to 30 minutes? I used to go in person all over. And I know some of those centers, when we were talking like Moorhaven, Clewiston aren't 2 hours away, but it's worth it. People appreciate when you go and you really want to help and they want to make a difference. But now we're doing it because of the pandemic. We've been doing it via WebEx, Zoom, Microsoft Teams, whatever works for them. And that's the key. You really have to work together for this to be effective. So here's our first meeting. We established a partnership. The first meeting is only 15 to 30 minutes. Again, they're all very busy. I'm going to send them the interest form and application to the asthma lead at that time. Occasionally there's centers that'll contact me, they'll look at the map and they will not have filled out the interest form, is why we do it that way. I'm going to help the child care center and the school determine who's their asthma leadership. Some of the centers that have several centers in a county, they'll take all their directors and mix that their leadership team. If it's one center, they will identify people that are going to be there on their asthma team. It can be 2 people, it can be 15. It's really up to them. We'll set up, here's the key for this, okay, for all of you that are wanting to work with to help centers be asthma friendly. At that meeting, I set up the date and time to teach asthma basics and medication training. And you're going to see why as we go further into this. We do it again via WebEx, Zoom, whatever platform, and I know it's confusing at times. And we ask the asthma lead to have the sign-in sheet for the training. So when we actually do the training, they're going to send me the sign-in sheet right away. So at this point during the meeting, I'm sending them the link for the training. We offer WebEx at Lee A lot of times centers will say we prefer Zoom or other platforms, and that's okay. So they'll send me an invite. So I put this picture in here because I know not everyone is tech savvy, so it can be a little intimidating. You know, which one do I use? And also some of these people are on phones, some are on computers. So we have to figure out what platform works best for them. And there's numerous options. They can be confusing. There can be individual access issues, learning curve. So we really want to, again, work with them. I know I had to learn a lot of this when we went into the pandemic to make sure we could reach our patients and community members. So at this, remember, we had the first meeting where we set everything up. So now we're in our second meeting, and I'm teaching asthma basics and medication training. And usually those are 2 hours. We've been able, because we have to meet their needs, right? Everyone's very busy. We can do that. And I say we, like yesterday after the mini review course, Robert Seifert and I, my colleague, we taught the asthma basics and medication training, and we did it via Zoom. We did that in the evening. We asked attendees always unmute and use video if possible. The same as I said to you, and I know this is a little different. I want them to interact. If they do not understand something, I need them to let me know right then and there. We do, and anyone who will hear me talk to the childcare, they will wonder probably extensive education on the definition of asthma, the muscle tightening, the inflammation, and the secretions. If they don't understand the very basics, I need them to tell me and we'll explain why. Just like I don't understand what they're doing in a childcare center, it's definitely not my area of expertise, but I want to make sure they understand. So once we get that down, then that enables them to bridge with a better understanding into triggers, symptoms, asthma action plan, etc. I think it's important that everyone understands the why. So bronze, just 1 second, I'm asking someone to bring me. Sorry. Okay, so here we are, bronze. This matches, just so you know, for you, those of you that seen the application, I did not want to, again, do a screenshot. So this will match up if you look at the applications for those of you that seen it. So the application, there's 10 criteria as far as the childcare centers. The bronze has the asthma leadership team, is number 1. And that, remember we talked number 1, we are setting up their team as soon as we're together. Just one. Can I get the agenda? I apologize. Needed something I forgot to bring into the room. My team is here. We're together watching this. So we help them. Remember at the first meeting, they establish their asthma leadership teams. We're in their app, and they fill this out and they write that. They have to submit the list, thank you, of their team members on the application. So then to staff training, everyone that took asthma basics, you can do it online. It's English or in Spanish, which is great. And also when we teach, we do not speak Spanish, but we will get one of our interpreters, or we can use an interpreting phone to teach in Spanish if we need to. You really have to identify your audience and meet them on their terms and their needs. So the asthma basics, and thank you so much to the Health Council. We will, right after we do our training, the asthma lead will send me their training list of who is signed in, and I immediately send it to the Health Council, and I think Brittany will agree. They quickly turn around and they send certificates for asthma training and also the medication training, asthma basics and medication training. So we will send that to you, and you will have to submit that as part of the application. And you'll also have to do the post as if you're doing it online. What you need to know with the Florida Asthma Coalition, for the most part, you have to use a curriculum that's on there, but they do make exceptions. If you have a curriculum that matches or something close, and there's a reason, like for us, we're still teaching our curriculum, but we're doing it virtually, so they won't be doing a post test. And then on the application, they just write the number of staff they have and how many participated. So if you look at that, just within our 2 meetings with Lee Health, they've already met the first 2 requirements, right? And there's out of 10. So now we're still in the bronze level, asthma action plans and parent communication. So children with asthma, they need an asthma action plan. It's not something you can pull off a website. You can pull off, a lot of them are different. They have the similar green, yellow, and red on them. But again, they're different. The key to this, it has to be signed by the provider, okay? Has to be. It's not one that a parent can just fill in. So if they have 70% of the children with an action plan, they're on the bronze level. As you can see, 80% silver, 90% gold, and 100% platinum. So again, they write down the number of children they have with asthma and how many asthma action plans to figure the percentage. What we at Lee Health do, we feel very strongly, and I respect all centers. We get very excited to teach them. It's really where our passion is. But I think it should always be 100%. What about the child that doesn't have an asthma action plan and he has an exacerbation in your area? They all need a treatment plan, okay? And their medications. And then on number 4, parent and child care provider asthma communication. What this is they'll provide 5 forms to all parents upon the child's enrollment. And I think it's really important. What I've found is childcare centers are incredibly good at providing communication to the parents during the day, how the child did, were they happy, were they sad, were they coughing, just anything necessary about the child. But what we're not seeing is the parents providing information. And I think a lot of parents will even drop children off sick, not because they don't care about the child, but it's a lot of single family homes and they need to work. So this is really important. So the parent will fill in, I gave the child rescue medicine. The child is coughing before they drop them off. So everyone's prepared.
And Teresa, I see we had a question. Do you score and do the staff have to pass the post test?
We do not, but we ask a lot of questions. And I'll be honest, before the pandemic, we would print off those post tests, pre and post. It is before Asthma Basics. We would take them in. It was Asthma 101. I'm trying to remember. And they would fill all those out. And for the medication training, we had to do pre and post. If you would like us to do that, we are happy to send and have them to do that. We have no problem. It's just what we've done, like I said, since the pandemic, make some changes. We found a lot of places are short staffed and it was a time issue. So here we are on the bronze level now. So there's posters. The Health Council will send you these posters. Every center has to have these put up somewhere and you can see them in the red. One is, it's really good, steps to follow for an asthma episode. And really when you have an exacerbation, if you think about it, what happens? You get that adrenaline rush, you get nervous, and sometimes we do not react like we should. And that, whether you're a healthcare worker, and I don't mean in the hospital, but even sometimes at home with your own child. So that's up in the centers and they immediately know, first time with any symptoms at all with the child, coughing, overtired. They say most children will not say that they have chest tightness, they'll say their tummy hurts. But any asthma symptoms you see, you're going to give that rescue medicine. And this asthma episode will tell you, you stop immediately what you're doing, you get them in a calm area. So it's a great poster. One is common asthma triggers and the top 10 actions to reduce triggers. Also, those need to be updated. You need to submit that every 2 years, okay? Updated and submitted. We renew everything within 2 years for asthma friendly, whether it's child care centers, schools, hospitals, provider, okay? So again, I know at Lee Health, we keep those posters. We try to make it easy. We used to go into the centers and drop them off. At this point, the Health Council is either sending them to us or sending them directly to the centers. They're really nice posters. You can also print them off the website and have, you can laminate them or put them in a sleeve or however you can put them in all the classrooms. Environmental monitoring. I want to tell you a little something about this because I was so impressed with one of our centers. So they have to go through their each room and they have an environmental trigger assessment checklist. You know, is there rugs on the floor? Like what cleaning products? It's really very thorough and they check if okay, do they meet that need or not? And we don't expect them to meet all the needs. The key is that we want to help them so they have an asthma friendly environment within the healthcare center. So we had it was an underserved population center and they were so appreciative of our help. And we went in and they did not score 80% on the environment trigger assessment. And they said they were going to work on some things, and they called me. It was maybe a week, maybe two later at the most. And they said, we want you to come over. So I drove there and I walked in, and they had the parents all got together and they painted the place. They pulled the carpet, they cleaned the floors, their playground, they had cleaned up all the leaves. It was immaculate. It was amazing. And to me, that was really touching, because it showed you can come together as a team and make a difference for these children. All those parents did not have children with asthma. So that was really impressive. It shows the difference we can make when we come together. So parent-child giver education. Families receive asthma education. We ask that when the centers are offering asthma basics for their staff, that they also offer it to parents. And especially now, it's just a link and they can get on, okay? If there's anything personal they need to discuss as far as their center, we can discuss that separately at another time. So that is offered. Families also receive asthma brochures, and we send them again to the centers. And these educational materials, they're distributed to families. And again, you just want to make sure through the Health Council that it's acceptable what we are giving to the children. So this is very important. That's why obviously it's large, but we need to provide resources to help parents and caregivers control the child's asthma. We have resources on the Florida Asthma Coalition website. There are really cute videos, how to use inhalers. I know we're busy. Please take the time to get on there. Lots of resources. Search for your community resources, and we must identify the child and parents or caregivers' needs. So call us if you have questions. And that comes down to, they don't have insurance, so we want to help them. There's a lot of assistance out there for medications. One of the things that this will be for the schools, but that really was heartbreaking, I called the manager for the nurses for Lee County School System, and we were speaking. And I usually will go to a meeting for an hour that week before they start school and talk about asthma, and working or hoping they'll be asthma friendly. And she said, we have bigger problems, Teresa. Asthma was important, but they had children without shoes and without food. So in order for us to be effective, we have to look at the whole picture, especially in these days. So you can see, there you go. Now we've met requirement 7 just in those 2 meetings. In-depth asthma medication training. We do not, it says at least every 2 years and within 6 months, at least 80% of staff have watched the videos. Excuse me. We find that it's really important, and everyone is not able to do this, that all staff need to do medication training. So we teach the medication training along with the asthma basics. So as you can see, just in those 2 meetings, when we were teaching, they've now met requirements 1 and 2 and 7 and 8. So they have 6 to go. So for gold, air quality plan and practices, their center will go on this site, airnow.gov. You'll receive alerts about air quality, and it's important that they do that. That way they can arrange inside activities if necessary. Asthma policy and procedure, this is to be platinum. And in my opinion, there is no reason to not be platinum if you've done all the requirements. The asthma policy and procedure, what the Florida Asthma Coalition is looking for, are you incorporating requirements to make sure that you continue to maintain your status as asthma friendly? So a lot of them will just repeat the requirements, say they'll continue to follow those 10 requirements on the application, as well as if someone new comes in, we'll have them to go online and learn asthma basics, medication training and such. So here we go with the schools. And I know there's a lot, you'll see a lot of words on these. And the reason I did that, you guys will be receiving the slides. I usually don't like a lot of words on slides, but the words match exactly on the application, except it minimized a few things. Okay, the first thing for Braun, you have to establish your asthma leadership team. And you want an asthma champion, someone that'll really lead the school's team. And you can align that with a wellness team with the school as well. And on the application, you just want to identify who this person is and how to get in contact with them. So bronze criterion 2, professional development for faculty and staff. You will, the American Lung Association Asthma Basics, it's a great program. It's free online course. And you'll want your PE teachers, your coaches, the health aides, anyone unlicensed. A lot of the schools do not have nurses in them. They may have aides. I know at least in Lee County, our nurses may have several schools and an aide in each one. And so we work with both the aides and the nurse. We want to make sure the child is really taken care of. Certificate needs to be provided, and always the certificates need to be good within 2 years. I must say that even all my staff are certified asthma educators, but we continue to take a lot of these courses because it just reiterates what we know. It also, we always can learn new things, okay? Completion of the Asthma and Allergy Foundation of America's Asthma Management and Education Online. This is a great course. It follows the asthma guidelines. It's for all LPNs and RNs in a school, and they will get 8.75 CEUs for that, okay? We're gonna go on. This is something that's really, really important, and I'm gonna read it. The Florida statute, let me move, like I said, this is partially locked. Our school, Florida statute, our school policy enables students with parent and physician approval to carry and self-administer meter dose inhalers, and all students reported to have asthma have immediate access to their appropriate medications. We give our children spacers to take their inhalers, and we really are the voice for our children and our parents. We've never really had an issue, but we will call the nurse and explain why the child is able, and we will work with them. We talked yesterday, the in-check dial to make sure they have the appropriate inspiratory flows to use their rescue medicine. And it really is important if they're able that they can carry that on them. Okay, student-centered asthma support, asthma action plans, and an asthma action policy. We're still in the bronze criterion for the number of students with asthma and the number of students that have asthma action plans. And you guys can read that. I'm not going to read it. Your level, whether bronze, silver, gold, and platinum, depends with the school, also on the percentage of the kids that have asthma action plans. The school must have an emergency protocol for all students with an asthma episode, even if they don't have an asthma action plan on file. And I know there was talk for legislators, so their nurses could have some type of albuterol inhaler or nebulizer within the schools. Some other states do have that, or like have EpiPens and such in the school. There's really needs to be a positive partnership with the parents, students, and the providers to best care for these children. Bronze 5, asthma awareness posters and video, and you can read, I'm not going to read those. Again, you're hanging posters. In emergency, you want to make sure most people are non-clinical, especially if your nurse is not right there, so they know how to manage an asthma episode. And for us, it's really important that that child knows. We start teaching our children very young as well. Criterion 6, physical education and opportunities. You want to go, all PE teachers and coaches do asthma basics. You want to follow that it's in core, it's a safe manner that all children are able to fully participate in PE with asthma or without. And the PE teacher should sign up for airnow.gov for alerts and provide indoor activity for poor air quality days. I want to just tell a quick story, and then I'm going to show you the air quality flag program. I had a child that wore oxygen. He was an asthma student, and he came and saw me. And one of the things I said, what do you need from me? What do you want me to do to help you? We talked to the parents and the children. Their needs and their goals are very different. He said, my PE teacher doesn't like me. It broke my heart. And I said, why would you think your PE teacher doesn't like you? And he said, because he makes me sit out every day. I said, I'm pretty sure he doesn't like you. Let me talk to him and see what's going on and why. I'm sure there's a reason. So this was a great mom who was very involved, and I called the PE teacher, and of course we gave the training there. And it was as simple as the PE teacher was afraid. He was non-clinical, he knew nothing about asthma, and he really wanted to make sure the child was safe. So he came, we sat and talked to him. The child came in again, and I said, your teacher really, really likes you. You know that, right? He really cares about you. And he said, he's letting me participate. So we have to work with people on their level, you know what I mean, and make sure we understand and make sure we meet the child's needs as well. Airnow.gov, there's a air quality flag program. This is just truly amazing. As you can see, green, it's a great day to be active. Yellow, it's a good day to be active outside. The flags represent the air quality. And what's wonderful, the schools, when they receive them, they're large flags, they'll actually hang them on the flagpole or somewhere else. So when the kids are getting dropped off or they're coming in, they'll know what the air quality, and also that tells them if they need to provide indoor activities instead of outdoor. Asthma self-management, this is for silver. Education provided to students with asthma. Remember, we don't just teach the parents. Parents are busy. They're not always right with the students. So we want our teachers to understand, okay? Or I'm sorry, our kids. The kids grades 3 to 5 will take what's called open airways for school. And the grades 6 through 10 will do kick and asthma. Criterion 8, asthma education for parents and caregivers. With the schools, we a lot of times will teach asthma basics in person or virtually based on their needs during their work days. And we do that even with childcare centers. So we may have to do asthma basic in the evening for the parents or caregivers. We want also you to know that we want the grandparents, we want anyone involved with that child to attend this. And you guys can read, I'm not going to read the slide specifically, that's on there really what you need to do, and it will match the application. So indoor air procedures, the school has indoor air policy and procedures. They're the EPA indoor air quality tools for school action kit. Call me if you're not sure how to get that. It is this large box. I ordered at 100 one day to give to all of our schools, and people were shocked when they came and delivered them literally on this crate. They're super heavy. They're maybe this big, but they're filled with all kinds of information. And I gave those to each of the schools. So they're definitely, again, a lot of resources. And then number 10 is a comprehensive asthma procedure to make sure they maintain their asthma status, asthma-friendly status. So I will just say this quickly, we're almost done, but for our child in schools, our childcare centers and schools in Lee County, when we as asthma educators at Lee Health see any child or school, we immediately call the nurse or school aide, our office staff. We educate them in the child's asthma needs, their history, ED visits, triggers, symptoms, medication needs, partnership is developed. We then call the pediatrician and request completion of medication forms and request the medication refills. We keep the forms within our system. And the reason is that if a child leaves a school, we don't have to get more medication forms. We'll again contact the nurse at the new school and provide them with that form. Our parent and child will always receive an additional spacer and nebulizer kit. And we again call the school and did they receive the form, the medication, the nebulizer kits. We find that most, probably about 75%, the parents have not told them their child needs medication, or they haven't been told the child has asthma. So the gist of the whole thing is it takes a team. And I hope I included everyone in there because I know there's more. But we cannot take care of those children on our own. It takes all of us, not just from the emergency room to the hospital, back out to their physicians, to their childcare center. It takes every single person. We wish we had a community health educator, a community health worker. We do not at this time, but again, we need to reach them also on their needs and their terms and within their culture and within their language. So anyway, thank you so much for this opportunity. I know I'm available for questions. I know we don't have but probably a few minutes left.
Well, thank you so much, Teresa. That was a fantastic presentation, and I know I definitely learned a lot, so we appreciate you taking the time. It looks like we do have about 2 minutes, so we might be able to squeeze in one question if anybody has a question. Otherwise, if you guys send questions or comments through the chat, we can be sure to get those to Teresa and follow up individually as well. So like I said, about 2 more minutes left in this session, and then we will be moving on to the next session.
Teresa, my name is Nicole Sutton, and I did submit a question directly to you about how to best protect our kids, particularly this, because I'm not only a public health person, but I'm also a parent of a 5-year-old with really well-managed, I guess you could say, but severe asthma. And so I just submitted a question, and I hope I can be in touch with you about how best to suggest to especially other parents who I think might not understand too, how to how to be able to work with the school around some of these issues.
So do you have contact information for me? I mean, I am truly happy to talk to you. I think, like I said, this isn't even my main work group, but I attend it because it's so important. Like
Yes.
you, I have a child that was very, very sick in the hospital years ago when she was 8. She's now 22. So as a parent and like you, a healthcare worker, I see both sides. Do you, where did you send that? I don't have anything.
I sent it within in the chat directly to you, the direct message, right here through Zoom. But I also can contact you. Is your contact information on the website for the coalition?
It is in the mentor. It'll have my phone number in there, and I am happy to talk to you. Sometimes I think that's easier than just email, and it's
Right.
more personal.